Good afternoon from Ireland. My name is Andrés Brodkorb, and I'm live from my living room here in Middleton in Ireland. As most of you, we have severe restrictions here in Ireland. So usually I'm based in the Teagasc Food Research Center in Moorepark, but today I'm in my living room. So this is our fifth webinar on microencapsulation with a special theme of microencapsulation in food. I'm very excited to have two speakers from South America today, so truly international. I will show you a couple of slides first, introduction. Then we have the first talk, which takes about 30 minutes, the second talk, about 10 minutes. They're pre-recorded, and then we meet again for live question and answers, and I have a few final remarks on future events. So we should have everything wrapped up within approximately 1 hour. Okay, so without any further delay, I will show you the first slide. So we have two speakers. The first one is María Victoria Defain Tesoriero and Ramiro Andrés Iturralde, and I've been practicing all morning pronouncing this. Both are from Argentina, from the INTI Institute. The webinar is co-organized by two organizations. The bigger one on the left, the Bioencapsulation Research Group, and that has been a group for many, many years, even decades. They've organized over 80 conferences, training schools, industrial conventions, over 7,000 contacts or members from over 80 countries, with a large emphasis on industrial problems. Hence, we have a lot of industrial members. We also have a very active LinkedIn group. So if you want to join the group, just go to LinkedIn, go to type in microencapsulation, and you can follow it. And of course, the website bioencapsulation.net. The second organization is Ncap for Health, which is a project, a Horizon 2020 project, coordinated by Stefan Drusch in the university in Berlin. The project basically funds research exchange between 30 researchers, 12 expertise, 8 countries again. And we have a LinkedIn group, Ncap for Health, and you can follow any future events. So our first speaker, María Victoria, has finished her PhD in Technology and Science of the University of Quilmes, and she's a biochemist. And since 2000, she is employed in the INTI, the National Institute of Industrial Technology in Argentina. She's also a professor at the University of San Martin in biochemistry for food engineering. And they basically provide, or she provides, innovative technologies or technological solutions to a number of industry sectors, among them pharma, cosmetic, food, veterinary, textile, and agrochemistry. And she focused her work on scalable process, including nano and microencapsulation technologies. And her main technologies, they're really, a lot of different technologies: spray drying, lyophilization, high pressure homogenization, coagulation, ionic gelation, and microencapsulation. So without any further delay, I hand over to María Victoria. You see a box at the bottom of your screen, question and answers. So please type in the questions and we will answer them at the very end. It would be great if you type the question during the talk rather than when we are in the middle of the question and answer session. So I hand over to María Victoria.
Good afternoon for some people and good morning for others. I'm glad to be here with you. The topic I intend to show you today is about microencapsulation in food. And I will show you different solutions applying different technologies depending on the product and its use. But first, I want to introduce in few words something about the National Institute of Industrial Technology, INTI, to make it known. INTI offers an excellent link between science, academia, industrial associations, and companies. We are organized in 52 research and development centers spread over the country. Besides, it meets the demands of more than 25 industrial areas. Its aim has two axes. The first, to strengthen methodological capacities of the country and transfer quality to industry. INTI is the Argentinian Metrological Institute. And the other, to promote industrial development by innovation and technological transfer. And today, I talk to you in respect to the last, focusing in food application. So, let's see what we can find in food. Nutrients, health, energy, pleasure, illness prevention. If we talk about health or illness prevention, we talk about medicine. What about the difference? Foods are administered as chronic and massive way, and some nutrients are bioaccumulative, so we should keep care with this. To ensure the optimal intake of micronutrients as vitamins for the total population, more than 60 countries around the world have implemented fortification plans to fortify staple foods. In 2006, the World Health Organization and Food and Agriculture Organization published micronutrient fortification guidelines to ensure the best practice in fortification plans. There are Latin American experience with fortification programs, and in Argentina we have the following: fortified flour with vitamins, iron and folic acid, salt with fluor, tap water fluoration in some areas. Then, microencapsulation technologies may arise as a great solution. But what is microencapsulation? Microencapsulation is a process of encasing micron-sized materials in a polymeric or lipidic shell. The material to be encapsulated may be referred to as internal phase, core material, fill, payload phase, or activation, whilst the encapsulating material may be referred to as membrane, carrier material, coating, shell, matrix, external phase, or wall material. Moreover, microencapsulation has the potential to protect sensitive compounds, preserve desirable flavors and aromas, or mask unpleasant appearance or taste. Microencapsulation can facilitate the convenient handling of materials by allowing the conversion of liquid food material into a solid or free-flowing powder, or vice versa. An additional benefit of microencapsulation is to provide a suitable concentration and consistent dispersion of the core material. Microencapsulation is a cross-technology. It has different application fields, and our research issues are focused in the following fields: food, pharmaceutical, cosmetic, veterinary products, agrochemical, and textiles. In general, the first step for microencapsulation involves homogenization of the core materials and wall materials to create an emulsion. Emulsions are considered carriers for active ingredients, both lipophilic and hydrophilic. What does it happen with a patient in intensive care who cannot be fed by oral route, or with a preterm newborn in critical state? A few days later, that a critically ill patient stays in hospital, enters in an energy deficit, and then in a malnutrition and impairment state. It is necessary to administer calories to improve his or her prognostic by means of parenteral lipidic emulsion. Parenteral nutrition consists in providing nutrients via intravenous route to cover metabolic requirements and keep patients' nutritional states when enteral route is inadequate or insufficient. A typical composition is carbohydrates, proteins, electrolytes, vitamins, trace elements, and fats as a lipidic emulsion, oil in water type. Fats, lipids, and oils provide huge quantity of calories, but it should be administered in water matrix and have small drop size. Why? Because a bigger drop size can block small blood vessels. An emulsion oil in water is a system thermodynamically unstable. Then the disruption will occur. The challenge is that it does not happen before the expiration date. Stabilization depends on some factors such as raw materials, production process variables, and storage conditions. Surfactants are amphiphil substances used to stabilize the interface oil-water. If surfactants concentration is not enough, oil drops can stick. This phenomenon is called flocculation. Then, what can occur is coalescence. These drops can merge themselves and a bigger drop is obtained. Over time, both flocculation and coalescence can end in creaming or sedimentation. Other phenomenon is the Austral Rippening. Austral Rippening manifests itself as the growth of large drops at the expense of the smaller ones, which is due to the diffusion of dispersed phase molecules through the continuous phase. It occurs because the solubility of the material within a spherical droplet in the surrounding continuous phase increases as the radius of the droplet decreases. In a polydisperse emulsion, there is a greater solubility of dispersed phase molecules around smaller droplets than around large drops. Consequently, dispersed phase molecules move from small droplets to large drops because of this concentration gradient, which causes the larger drops to grow at the expense of the smaller ones. So, it is important to produce monodisperse emulsion with a small droplet size in order to get stable emulsions. Parenteral lipidic emulsions must have strict quality control. As an example, USP specifications are particle size distribution, it should be below 500 nanometers. This is determined by dynamic light scattering technique. And it is very important that drop percentage over 5 micrometers should not be bigger than 0.04%, and it is measured by light obscuration technique. Free fatty acids concentration should be below 5 millimolar, measured by potentiometric titration, and these parameters is indicated as instability and systemic toxicity. Finally, pH should be between 6 and 9. In this sense, we work with a pharmaceutical company called Govinovac to develop this product. To produce it, we use high-pressure homogeneous agent. In this technique, a lot of energy is applied on the sample and structures, vesicles, particles or drops are broken and assembled by means cavitation, turbulence and or shear effects. Cavitation is a hydrodynamic effect and occurs when the fluid passes through a very small hole. Based on Bernoulli principle, if pressure falls down below fluid vapor pressure, fine bubbles appear, and when they pass to a zone with higher pressure, they collapse and the surrounding structures are broken. Turbulence is an irregular movement observing liquid which flows at high speed. This is a chaotic movement, and molecules, instead of going parallel ways, describe irregular pathway and create twisters and whirlpools. Meanwhile, shear force produces a transversal cut due to tangential plane slide with opposite sense generated by fluid movement as a scissors. This method had some advantages. There are different scale models, results are easily transferable to industry, and it is relatively simple to use in a variety of applications. Homogenizer can work by cycles or by continuous mode. We used an Emulsiflex C50 by Avestin and multifactorial design of experiment. We studied oil-water ratio, surfactant concentration, cycle numbers, and pressure. And we achieved a stable product complying with the specifications. The highest pressure, the worst sample. In this case, when drop size was diminished, we create area, surfactant was not enough, and it does not cover all generated interface, getting an overprocessed sample. We find that it's important to observe the sample. Always, it is essential to use complement techniques. One of them should be a microscopic technique. Furthermore, Dr. Driscoll, expert in lipidic emulsions, had advised using differential interference contrast system coupled to optic microscopy as a complement high sensitivity method to light obscuration technique. Now, I'd like to talk about encapsulation of oils. Omega-3 fatty acids are polyunsaturated fatty acids characterized by the presence of a double bond 3 atoms away from the terminal methyl group in their chemical structure. They are widely distributed in nature, being important constituents of animal lipid metabolism, and they play an important role in the human diet and in human physiology. The 3 types of omega-3 fatty acids involved in human physiology are alpha-linolenic acid, ALA, eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA. Foods rich in these active ingredients are veggies, seafoods, algae, and some vegetable oils or seeds such as flaxseed or chia. Health benefits associated to omega-3 fatty acids consumption, together with the high susceptibility to oxidation of omega-3 containing oils, have led to the development of microencapsulated oils for nutraceutical and food enrichment applications. Furthermore, an important problem that this chemical composition entails is to guarantee the stability of the oil during food processing. Therefore, robust unit operations must be designed in order to produce high-quality microencapsulated omega-3 fatty acid enriched oil as a food ingredient. There are some products fortified with different oils around the world. Here there are some examples from Norway, China, Australia, Canada. We had experience with microencapsulation of fish oil, linseed oil, and chia oil. All of them are oils enriched in omega-3 fatty acids. The standard preparation method involves a first step of emulsification and a second step of spray drying. As regards variables to take into account in both steps, I recommend the two excellent seminars we had at February 11th and 25th, given by Dr. Jenny Weisbrot and Dr. Stefan Drews, respectively, which are still available online. However, I want to highlight what follows. Regarding the fed emulsion, I have just explained earlier some aspects about emulsions. In this regard, it should have both low viscosity and low particle size with the major solid content. However, the higher the concentrations of the feeding solution, the greater the viscosity and hence the possibility of obtaining agglomerated and irregularly shaped particles. So, it is necessary the optimization of these parameters. Besides, it is important the feed emulsion containing the wall materials and the core substances should be stable throughout the processing time. And previously, to prepare the emulsion, typically the first stage is carried out by dissolving the wall materials in water and being maintained overnight at room temperature to allow full hydration and shrinkage of the polymer molecules. In addition, other controllable parameters that result in the improvement of the dried products related to the characteristics of the fed solution are the composition, the surface tension, the nature of the solvent, and the glass transition temperature of the ingredients by separated and mixed. In respect to spray drying variables, the feed rate, which refers to the volumetric flow of the liquid stream, has a direct effect on the particle size of the powder obtained. The higher the feed flow rate, the larger the particle size of the final product obtained. The inlet temperature must be chosen as high as possible for obtaining the lowest moisture content in the product, while avoiding the thermal degradation of the active compounds. However, the glass transition temperature of the dry solid must be lower than the inlet temperature in order to prevent particle agglomeration, particles adhesion on the walls of the drying chamber, and microstructure collapse. The outlet temperature is an experimental variable that cannot be controlled directly by handling the instrument, but rather is a consequence of other factors such as gas inlet temperature, gas flow rate, enthalpy obtained. Additionally, the use of high feeding rates increases the moisture content. Then, a bigger difference between the inlet and outlet temperature must be set. It is desirable at fast film and continuous glass phase formation depending on an adequate isotherm curve. We had begun with this research and development line using fish oil. We verified with this study long time ago that it is necessary to use high-pressure homogenization for obtaining a stable emulsion and a powder with the minor extractable oil in accordance with superficial oil. We used skim milk as wall material and the optimum feed was 35% weight by volume, determined by Marchoni method. Besides, ALA, EPA, and DHA ratio and content determined by GC-FID by area normalization remain without significant changes. Now, let's move on to the next oil. The aim of this work was to obtain different formulation for linseed oil microencapsulation by spray drying with high encapsulation efficiency and evaluate their resistance to oxidation through the accelerated Rancimat test. 4 formulations were tested using different combinations of gamma-arabic, maltodextrin, methyl cellulose, and whey protein isolate. These 3 formulations had the best encapsulation efficiency, over 90%. Microcapsules made of 100% gamma-arabic and ternary mixtures of gamma-arabic, maltodextrin, and whey protein isolate presented the highest protection from oxidation. And the microencapsulation process did not affect neither omega-3 content nor omega-3 profile. Although the 3 of them presented non-porous surfaces, the ternary mixture microcapsules were the most spherical and smooth, which kept unaltered after 10-month storage. Whereas gamma-arabic microcapsules had wrinkled structures and gamma-arabic maltodextrin microcapsules presented some irregularities that appear like surface cracks. This might be one of the causes of the reported induction period differences by Rancimat method. The induction period is the time required to produce a sudden increase of conductivity, which can be defined as an indirect measure of oil stability. The higher the induction period, the more stable the sample. Gamma-arabic containing formulation was included in bread and cereal bar manufacturing, and the omega-3 percentage obtained was similar to theoretically calculated in both cases. In particular, fortified bread resulted similar in appearance to control bread without microcapsules, but alpha-linolenic acid content was reduced significantly after preparation. This work was ongoing with an oil producer, but finally the product did not reach the market. Recently, we worked in a project led by Dr. Marcela Martinez from Córdoba University from Argentina to encapsulate chia oil. For preparing fed emulsion, soy protein isolate and gamma-arabic were dispersed in order to obtain a total biopolymer concentration of 12% weight by volume and 1 by 1 soy protein isolate gamma-arabic ratio. This dispersion was emulsified with chia oil by means high-speed homogenization in a 2 by 1 wall-core ratio. The particle size was diminished by high-pressure homogenization. Then the pH was diminished and the resulting quasarvate was dried with the addition of maltodextrin. A traditional design of experiments was performed to analyze the effects of inlet temperature and volumetric feed rate. A statistical treatment of the spray drying parameters in 2 concurrent spray dryers with different aspect ratio, a tall and a short form, was carried out. The outlet air in the short form was cooler and more humid than in the tall form. As a consequence, products with higher moisture content and water activity values were obtained in the short form. These powders were also characterized by the presence of larger particles, a more heterogeneous size distribution, and more aggregated oil droplets in reconstituted emulsions than for powders from the tall form. In addition, the products from the short form exhibited a more yellowish macroscopic aspect. Finally, they showed a poorer oxidative stability not only compared with the microcapsules from the tall form, but also with bulk chia oil. A simple drying kinetic model was applied in order to calculate a theoretical single droplet evaporation time in both dryers. The values obtained for droplet evaporation time were on the order of milliseconds for the tall form and seconds for the short form, being comparable to other previous reports. The other estimated response was the additional exposure time of dry particles in the chamber. The values range around 1 second for tall form and about 23 seconds for the short form. Therefore, especially when drying heat-sensitive products, it should be considered some aspects such as the disperser design, the droplet behavior during drying, the chamber dimensions, and the method for powder discharge. As a concluding remark, it is worth highlighting that significant correlations were found among droplet evaporation time, exposure time, and some properties of the powders. For instance, droplet evaporation time was correlated to moisture content, water activity, and particle size parameters. In addition, exposure time was correlated to color of powders and to their chemical quality, measured by peroxide index and oxidative stability index. As I told you at the beginning of this talk, our challenge is to promote industrial development by innovation and technological transfer, especially to small and medium-sized enterprises. I have showed some examples related to nutrition and food. Two of them we have transferred, parenteral emulsion and linseed oil encapsulation. However, the latter case did not reach the market. With this, I want to tell you that the technological transfer is not easy. We use lab-scale technology with scalable processes, and in the measure as possible, we select the lowest cost raw materials to do much easier the technology transfer in developing countries such as Argentina, but it is not always possible. For each product and process, I have talked about the importance of the quality control and the characterization technique and the critical variable to control the process. To conclude, we want to show you a successful case of technological transfer in food application using microemulsion technique. So, I give the floor to Ramiro Iturralde. Thank you for your attention and your time.
Hello, my name is Ramiro Iturralde. My background is in food technology, and I work at the National Institute of Industrial Technology in the group led by Victoria Defain. Today I'm going to talk about how we assisted a small industry that produces additives for the fishing industry in the development of an antimelanosic microemulsion for prawns. First, I want to briefly explain what is a microemulsion and to point out the differences with nanoemulsions. Micro and nanoemulsions are colloidal dispersion consisting of two immiscible liquids, one dispersed into the other. They are usually prepared using the same components, oil, water, and surfactant. However, a greater surfactant to oil ratio is required to prepare a microemulsion. The major distinction between nano and microemulsions is their thermodynamic stability. Nanoemulsions are thermodynamically unstable, whereas microemulsions are thermodynamically stable. For a nanoemulsion, the free energy of the colloidal dispersion, the droplets in water, is higher than the free energy of the separate phases, oil and water. On the other hand, for a microemulsion, the free energy of the colloidal dispersion is lower than the free energy of the separate phases. The reason that microemulsions are thermodynamically stable, despite having a large specific surface area, is because the interfacial tension is very low when the surfactant monolayer adopts its optimum curvature. The particles in nanoemulsions tend to be spherical because a sphere has the lowest interfacial area for a given volume of material. On the other hand, the particles in microemulsion may be spherical or non-spherical depending on the optimum curvature of the surfactant monolayer and the amount of oil incorporated into the system. To be consistent with government regulations on nanoparticles, such as those of the European Union, nanoemulsions should have mean diameter below 100 nanometers. Microemulsions are not emulsions of microscale droplets formed by shear, but rather nanoscale, self-assembled equilibrium phases with structures between 1 and 100 nanometers. According to fabrication methods, in principle, microemulsions can be formed spontaneously by bringing oil, water, and surfactant together without supplying any external energy, since they are thermodynamically stable systems. In practice, it is often necessary to apply external energy in form of stirring or heating to facilitate the formation of a microemulsion because there are kinetic barriers that must be overcome. In contrast, nanoemulsions always require the input of some external energy to convert the separate phases components into a colloidal dispersion because there are thermodynamically unstable systems. So what is melanosis? It's an enzymatic browning oxidation, very common in crustaceans during post-harvest storage. This reaction is catalyzed by a naturally occurring enzyme, polyphenol oxidase, that in the presence of oxygen converts monophenols and diphenols, both colorless, into highly colored quinones. The quinones react to oxygen and gives place to a high molecular weight insoluble polymer called melanin. Although melanosis causes no direct harm to consumers, it damages the sensory features of crustaceans, decreasing their quality, shelf life, and subsequently their commercial value. Since prawns are valuable trade products, for example in Argentina, shrimps and prawns are the main species exported in the fishing sector in terms of value, and they generate exports for over $1,000 million per year. So in order to avoid economic losses, different preservation methods are used and studied to prevent melanosis. These methods focuses on eliminating one or more of the essential components of the process: the enzyme, the oxygen, copper, or substrate. Copper is a cofactor of the enzymatic reaction. The most common inhibitors are reducing agents, which act by causing the chemical reduction of pigment precursors, acidulants, or chelating agents, which reduce the level of copper available. The traditional method for treating prawns consists on dispersing or dissolving these agents in an aqueous bath and dipping the shrimps for a certain time, or spraying with a blend of antimelanosic products. Worldwide, sulfates are used as the main inhibitors of melanosis, primarily metabisulfite. However, sulfates have potentially pathological effects, and metabisulfite is believed to trigger asthmatic attacks, causing serious allergic reactions. The company we work for is Defain Austral, and the aim of the work was to develop an antimelanosic formulation with 4-xylresorcinol as the active ingredient instead of metabisulfite because of the health issues I mentioned before. Its chemical structure is a dihydroxybenzene with an ethyl group in the 4th position. It's a white powder, almost insoluble in water. It's an additive authorized in Argentina by the National Service of Health and Food Quality and in the European Union by EFSA to be used for prevention of melanosis in crustaceans with a maximum permitted level of 2 milligrams per kilogram as residue after treatment. This is an important issue since shrimps are exported, being Spain the main buyer. And as advantages of xylresorcinol over sulfites, we can mention its specific polyphenol oxidase inhibitory action and its lower quantity required for effectiveness, with a use dose times 1,000 times lower compared to the metabisulfite. Crustaceans should be treated as soon as possible to prevent the progression of melanosis, because refrigeration or storage on ice slows down but does not prevent this reaction, so they usually undergo immersion or spraying on board. In order to meet users' needs, the product should be easily dispersible in water, and xylresorcinol should be already soluble to accelerate the mechanism of action. The simplest formulation was an oil in water microemulsion, where xylresorcinol is solubilized with food-grade Teagasc. One of the advantages of microemulsion is their stability. They are self-assembled or with minimum energy delivery, so it's not necessary to use expensive equipment, which cuts investment costs. On the other hand, a great amount of surfactant is used. However, as the formulation is concentrated, it must be diluted 1,000 times before used. That happens in the treatment bath on board, so the final concentration is within the permitted levels. There was also addition of antioxidants, pH-reducing agents, and humectants according to the client's requirement, which enhance product performance. According to characterization, 4-xylresorcinol was determined by HPLC with fluorescence detector. Stability was made following recommendations from Anvisa, the National Health Surveillance Agency from Brazil, that consists on centrifuging 30 minutes at 3000 RPM, and CPAC, Collaborative International Pesticides Analytical Council, who proposes a severe accelerated stability test in which the product should be kept 14 days at 54 degrees Celsius. Anvisa test was successful, but with the CPAC test we observed phase separation that nevertheless, due to the nature of the formulation, was homogenized upon handshaking. We used Anvisa and CPAC because there aren't recommendations in Argentina for emulsion stability tests. Once we got the formulation, we worked on technology transfer. It consisted in scaling up the process, advising on the purchase of equipment, and providing technical assistance in company. The product was approved by the national authority, SENASA, and it is commercially available to be used in Argentina and also exported. It has recently been approved in Ecuador. INTI and the client also signed a royalties agreement. And there was also dissemination done by articles in local newspapers, web pages, and radio. Thank you for your attention. If you want to know more about INTI, check our social channels.
right